Welcome to the deep dive. We're here to cut through all that noise and, get you the insights that really matter.
It's true. There's just so much information flying around all the time.
Especially with health stuff, right? It feels like a constant stream. And sometimes you're looking at the big headlines, but the really interesting, maybe important stuff is happening somewhere else, maybe a bit under the radar.
Absolutely. Regional shifts can easily get missed, but they often have wider implications than we first think.
Exactly. And that's why today we're doing a deep dive into something specific. A recent resurgence of SARS-CoV-2, COVID-19, that's been happening in Bangladesh and India. So our mission today for you is to really unpack what's going on. What are the specific subvariants popping up? What's the situation actually like on the ground in both countries?
Yeah, and how does this fit into the bigger picture? Like, what's the WHO saying?
Right. And what's the practical advice? We'll try to pull out the most important nuggets so you can feel properly informed.
It's definitely a vital topic, especially since, well, the world is so connected.
Okay, so let's dive in. Starting with India. What have we been seeing there lately? Infection rates?
Well, there's been a definite upward trend, yeah. Through June, the active cases have sort of bounced around, generally between, say, 6,000 and maybe 7,400.
Okay, so fluctuating but noticeable.
Exactly. And to get more specific, there was a ministry report around June 14th. It showed active cases were up near that 7,400 mark.
Wow.
And in the 24 hours just before that report, they'd logged 269 new infections and, unfortunately, 9 deaths as well.
And what's driving this? Are we seeing new variants emerge?
We are, yes. They've spotted several new Omicron subvariants, names like XFG NB.1.8.1, LF.7, and also JN.1.1.
Okay, quite a few there. Anything specific about, say, XFG?
Well, the interesting thing with XFG, they tracked 163 people infected with it, but the reports consistently mention mild symptoms.
Okay. So infectious, but maybe not as severe.
That seems to be the pattern, yes. It reinforces this idea that while the virus is still around, its severity might be lessening, particularly for people who are vaccinated. It sort of changes the challenge, Less about overwhelming hospitals, maybe more about managing widespread, but milder illness.
That's a really key point about how the impact is evolving. But mild for some doesn't mean zero impact, obviously.
Right.
What about mortality? The deaths you mentioned.
Right. So for this current wave, the total deaths reported are 108. And there was one particularly tough day, June 16th, where they reported 11 deaths in just that single day.
That's still significant. And you mentioned the monsoon season starting there. Doctors are worried about that, right? How does that complicate the picture?
Yeah, that's a big worry. Doctors have pointed out, the monsoon season always brings a spike in other respiratory illnesses, flu, things like that.
Right.
So if you have that happening and a rise in COVID, especially in really populated states like West Bengal, you get this potential for co-infections, people getting sick with multiple things at once.
I see. Making diagnosis and treatment trickier.
Exactly. And it just puts more strain on the healthcare system that's already dealing with the usual seasonal load.
That adds a whole other layer, doesn't it? Okay, so that's India. How does the situation compare in neighboring Bangladesh? What are they seeing?
In Bangladesh, the daily numbers reported in June have been, lower, generally finding around 10 to 15 new cases each day.
Okay, smaller numbers daily.
Yeah, for example, Dhaka district. 6 days ago, they reported 10 cases. In the 5 days since then, 15 cases total. So it's present, but not the same scale as the Indian figures we just discussed.
Got it. But are they seeing the same variants? You'd expect some crossover?
They are. The Bangladesh government is definitely keeping a close eye on those same variants. LF.7, XFG, JN.1, and NB.1.8.1, they're being very vigilant.
Makes sense. And what are they doing to manage it? Especially considering the close ties and border with India.
They've really stepped up screening, strict health checks at the BNI airport and also at the land border crossings.
So trying to catch cases coming in.
That seems to be a key strategy, yeah.
Yeah.
Proactive border monitoring to try and limit that cross-border spread.
And what about advice for the public within Bangladesh? What are the health authorities saying?
Well, the main health bodies there, the DGHS and the IEDCR, they're advising people to maybe hold off on unnecessary travel for now.
Okay.
And just generally be cautious in crowded spots, markets, schools, big public gatherings. It's really about promoting that personal caution and collective awareness.
Right, the standard precautions. Okay, let's zoom out a bit then. What's the WHO's perspective on this? How are they seeing this trend in the wider Southeast Asia region?
The WHO puts out regular reports, and the one for Southeast Asia as of June 1st kind of confirms the picture. It showed India reporting nearly 4,000 new cases, 3,961, and 20 deaths in the week leading up to it.
Okay.
And in that same week, Bangladesh reported 47 new infections. So it gives you that regional snapshot WHO is tracking.
And are they classifying these new variants globally? Does that designation mean anything specific for us?
They are looking closely, specifically that NB.1.8.1 variant. The WHO has tagged that as a variant under monitoring globally.
Variant under monitoring. Okay, what does that signify? Alarm bells.
Not necessarily alarm bells, no. It's more about active vigilance. It signals that they're watching it because it seems to be spreading, particularly in Southeast Asia. And they need to keep an eye on whether its characteristics, like how easily it spreads or how sick it makes people, might change.
So it's basically a flag saying, keep watching this one.
Exactly. Keep it on the radar.
Okay, so let's bring this back to practical takeaways for you listening. What does all this mean? It sounds like that increased border screening is a noticeable measure.
It is. That heightened health screening at land borders and airports, especially those connecting India and Bangladesh, that's a key tactic governments are using. For you, it just underlines that border vigilance is still part of the playbook for controlling outbreaks.
And beyond that, those basic precautions we've all learned, they still matter. Right.
Absolutely. They haven't gone away. The core advice is still vital. That means, considering masks in crowded indoor places, washing your hands often, making sure you're up to date with your vaccinations, getting booster shots if you're eligible.
Fundamentals.
They're still your best lines of defense, really, across different variants.
And what if someone does start feeling sick? Even mild symptoms?
The advice is pretty clear. Isolate yourself right away, even if it feels like just a cold.
Why is that still so important?
Well, early isolation helps stop you spreading it further, whatever it is, and it gives you a chance to monitor how you're feeling without putting others at risk.
Makes sense. And thinking back to that monsoon complication in India, what's the advice there regarding getting medical help?
Yeah, because of that risk of getting COVID, plus a seasonal illness, doctors are advising people to be extra careful. Basically, if you have symptoms that seem unusual, or if they start getting worse, don't just brush it off.
Seek medical advice promptly.
Exactly. Get checked out to make sure you get the right diagnosis and the right sort of integrated treatment for whatever might be going on.
Okay, so let's just quickly wrap up the key points we've covered. We're seeing new Omicron subvariants causing a rise in infections, especially in India. Active cases got up to around 7 to 400.
Right, but a key takeaway seems to be that most of these cases are being reported as mild, so the virus's impact might be shifting.
Meanwhile, in Bangladesh, the numbers are lower, and they're managing it with tighter border screening and public health advice.
And the WHO is watching the region, flagging a potential new wave in Southeast Asia, which really just highlights that those basic health measures, masks, vaccines, hygiene, they're still critically important.
Understanding these dynamics in India and Bangladesh, even if they seem far away, it's actually pretty crucial, isn't it?
It really is. These situations act almost like early warning signs. They show us the virus is still adapting, still changing, and it reminds us that even if variants are labeled mild, that constant vigilance is sort of the new normal for global health.
Which brings us to a final thought for you, something to maybe chew on. What does this constant emergence of new variants, even the ones called mild, actually tell us about how public health challenges are evolving? And maybe, how does that change how we think about staying vigilant and about our own personal role in this super interconnected world we live in?